This is Christine Porter with the Times News. I'm talking with Dr. Shahzad Khan about the prognosis and stages of Alzheimer's disease. He is a neurologist with Lehigh Valley Health Network.
Whenever you encounter somebody who, does have Alzheimer's, what do you tell them as far as what to expect and such?
It's like every patient is different. That's what I told the patient, that every patient is different. If you read some books or some scientific data, they claim that the lifespan can be anywhere from 3 to 20 years. But typically, patient may survive anywhere between 8 to 10 years. However, if you have a good care, like good care of your own, like if you have a good healthy habits, healthy diets, doing physical activity, you are not smoking, you are having good control of blood pressure, diabetes, high cholesterol, then the chance of survival is gonna go up, because all of those conditions gonna affect the brain. So there is a if you have all those risk factors are not well controlled, so there are two different pathology going to act on the brain. One is Alzheimer's disease pathology, which is affecting your brain. On the top of that, you have other medical issues which are affecting your brain. So having said that, if you have a good control of those vascular risk factor, then you may last, or your life expectancy can be as long as up to 20 years. The dementia stages are, as you know, is 5. So one is the preclinical stage, in which your brain start having the process of some accumulation of the proteins or the plaque, but you have no clinical symptoms, and that stage can last for 10 years. So now you start having, then the second stage is the mild cognitive impairment, in which you have mild impairment in the memory, but you are functioning well and you can do all those activities. So when they start having the mild dementia, when they have some difficulty in functioning up to their previous level, then the caregiver and the family and the patient, they tend to get a little bit concerned and start seeking the advice. So I believe this is the stage when we are talking about the life expectancy. So usually most of the patients come to the physician when they have sign of mild dementia or mild cognitive impairment. So at that time, if we start working well on our general health, it does help. And nowadays, the main interest or the focus of future research is on the prevention of the dementia, how we can prevent the dementia, and how we can treat in the beginning of the dementia.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.